the DeOndra Dixon Include Project Act. Thousands of Americans live with Down syndrome, and yet research has been underfunded for decades. In 2017, Congress encouraged the National Institutes of Health, the NIH, to launch the Include Project, an effort to make groundbreaking discoveries about conditions that disproportionately affect people with Down syndrome, like Alzheimer's disease. The Include Project brings together multiple NIH institutes under a coordinated approach that is already delivering significant scientific discoveries as well as new treatments. The bipartisan, bicameral DeOndra Dixon Include Project Act will officially authorize the Include Project into law. The bill will ensure that Congress and the American people have visibility into the scientific breakthroughs that are so needed for this community. The Include Project is already yielding significant scientific results, and Colorado is at the core of these scientific advancements. So, Mr. President, today Colorado is proudly home to the world's leading Down syndrome advocacy, research, and medical care partners at the Global Down Syndrome Foundation, the Linda Cernick Institute for Down Syndrome, the Alzheimer's and Cognition Center, and the C Center at Children's Hospital, Colorado. We need to make sure that improving health outcomes for individuals with Down syndrome remains a priority, and do so in honor of DeOndra Dixon, an extraordinary person who was an advocate, leaving a legacy that will help improve lives for generations. This bill has support on both sides of the aisle, including Senators Jerry Moran and Cory Booker, and Representatives Diana DeGette and Richard Hudson. We also thank Senators Bennett, Padilla, Capito, Coons, Van Hollen, and Ossoff for their support. We are determined to get this bill across the finish line for DeOndra and for the thousands of Americans who will see their lives improved for the better by this critical research. As in legislative session and notwithstanding Rule 22, I ask unanimous consent that the Committee on Health, Education, Labor, and Pensions be discharged and the Senate proceed to the immediate consideration of Senate Bill 1838. Mr. President, I ask unanimous consent that the Hickenlooper substitute amendment at the desk be agreed to and that the bill as amended be considered read a third time.
Without objection.
I know of no further debate on the bill as amended.
Is there further debate? Hearing none. The question is on passage of the bill as amended. All those in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes do have it. The bill as amended is passed.
I also would be remiss if I didn't recognize once again the incredible partners that have been behind this Down syndrome advocacy, research, and medical care, primarily the Global Down Syndrome Foundation, but also the Linda Cernick Institute for Down Syndrome, the Alzheimer's and Cognition Center, and the C Center at Children's Hospital, Colorado. Thank you.